The Occupational Health and Safety Act, 85 of 1993, is self-regulatory. It would be difficult for the Department of Labour to police and enforce the Act at all different organisations in the country. The law makes it the duty of both employers and employees to take responsibility for health and safety issues in their workplace. The aim of occupational health and safety in pest control is to understand the legislative and regulatory requirements to eliminate or reduce the health and safety hazards that pest control operators, or PCOs, and their workers are exposed to, as well as the hazards people other than people at work could be exposed to arising of or in connection with the activities at a work site. Operational occupational health and safety risk management is the day-to-day activity of identifying hazards and risks related to pest control activities, analyzing risks in terms of consequences and their likelihood, and evaluating the risks to prioritize action. The Act is based on the principle that dangers in the workplace must be addressed by communication between the workers and the employer. Pesticides are designed to kill and are classified as hazardous substances that have potential to harm human health. While on worksite, PCOs have to ensure the following. Health and safety are the PCO's responsibility, therefore take care of it accordingly. You are the key to your own safety. Reporting and consulting with health and safety representatives on a client worksite. Providing information, instruction, and training to the client's employees. Ensuring risk control measures are properly used and maintained. Keep a register of substances, including product names, labels, and material safety data sheets, or MSDSs. Health risks arise from exposure to insecticides. The PCO therefore ensures that pest control under his or her supervision is done with trained workers to prevent the dangers of poisoning. Knowing safety is not enough. Practice it. Health risk cannot be effectively controlled without having done a risk assessment. Once you understand the why, you can easily manage risks as follows. Eliminate or minimize the risk. Prevent accidents before they occur. Encourage and introduce safe work practices by identifying risks. Ensure that relevant factors are taken into consideration. Who should carry out the risk assessment? A person who has the knowledge and understanding of the work practices and pesticides. Therefore, the PCO. Study the manufacturer's label and MSDS or material safety data sheet. Consider routes of exposure, i.e. mouth, nose, eyes, and skin. Formulation of the pesticide, chemical, and physical properties. Potential health effects, i.e. acute single exposure and chronic exposure over a long time. Loading and transportation of pesticides. Evaluate the risk. Decide whether the current controls are adequate. If you are uncertain, gather more information. Therefore, the identification, assessment, and controlling of risk lies with the PCO. Occupational health and safety, 4 levels of risk control. Level 1. Elimination. Discontinue the use of pesticides or cease the work process. For example, use a vacuum cleaner on maggots, bedbugs, or fleas as a pesticide-free control measure. Level 2. Replace a pesticide or equipment with something similar that does the same control but with lower risk. For example, using rodent pellets instead of dust, or use cockroach gel instead of residual spray. Engineering controls. Change the process or equipment to reduce the risk. For example, using injectors with safety shields treating concrete slabs against termites. Use specially designed shelves for storing hazardous insecticides. Using exhaust ventilation in a chemical storage shed. Separate the driver's cabin from the chemical storage area on vehicles. Level 3. Administrative controls. Implement and enforce work policies, procedures, or practices. Policies. Policies are guidelines that dictate certain behavior within the organization. Policies must be documented and revised yearly. Ideally, your policies should be based on industry standards. For example, the SANS ISO 45001 to ensure compliance with regulations. Procedures. Procedures are step-by-step instructions that are designed to assist employees in following policies, standards, and guidelines. Practices. Practices are examples of actions that illustrate compliance with policies. For example, ensuring lids of pesticides are replaced securely when not in use. Regular cleaning of equipment and vehicles. Clean up spills immediately. No eating or smoking during the application of insecticides. Post warning signs on doors and windows during fogging and fumigations for the duration of the application process. Remember that administrative controls like policies are only effective when they are adequately disseminated, understood, and unilaterally enforced. Level 4. Personal Protective Equipment, PPE. A PCO is to use at all times the appropriate PPE as per the label of the product. A PCO has to use PPE in combination with all other control measures. Occupational health and safety regulations require that you document the results of a risk assessment and that the PCO ensures that the measurements be reviewed and, if necessary, revised. Regulatory and general health and safety for PCOs and fumigants. 1. Only persons who have been medically examined and found fit to work with insecticides and fumigants may work as PCOs. This is a requirement of the Department of Agriculture, and therefore workers must be examined by a health practitioner every 3 years as a condition before the P number renewal documents are reviewed. If symptoms of headache, dizziness, vomiting, diarrhea, and strange behavior become apparent, take staff to the doctor without delay. 2. Remember that reducing the risk proactively is better than dealing with the impact and losses reactively. 3. To ensure that workers can receive immediate attention, in the case of poisoning, they must never be allowed to work alone, especially fumigators. 4. Ensure all pest control staff understands the occupational health and safety policies and requirements. 5. Wear the prescribed personal protective equipment at all times when administering pesticides. 6. Triple rinse empty insecticide containers and store or dispose of them according to the label instructions. 7. Follow company safety policy at all times.